what are your indicators? So when we say concepts, events, or behaviors, so one thing to understand is that on your result chain or on your mail plan, you start with, especially for those of us that joined us, or if you go back to the video on developing a mail plan, the first thing on your column is the different types of results or the different levels of results, right? A result, maybe at the activity level, is that you want to carry out workshops or rallies, right? But so you need to measure those rallies. You need to measure those trainings. You need to measure those sensitization. You need to measure if you're providing a toolkit or IEC materials, information, education, and communication. You need to measure them. So what you use to measure those things you provide for your program or project is what we refer to as indicators. If you move a little bit up to the output level where you talk about access and reach in terms of results. So for example, it could be you access to maybe some pregnancy-related drugs or inducement or practice for pregnant women. So you can talk about the access to such as a result, like putting it as a result. So, but you need to measure it with an indicator. So it could the measure. So you need to measure the women that have access to such toolkits, guidance practice, counseling at facilities like health facilities. If you talk about smallholder farmers, maybe your project wants to provide improved seedlings. You talk about, okay, access to those improved seedlings. So, and you'll be looking at, so that's where you talk about different measures. And I'm going to go into the measures in a bit. So we say they are measures of your results, actually. So measures of concepts, events, behavior change. When we say behavior change, you can think about, so if it's a project on gender-based violence, for example, that I've reached out to maybe the male partner and the female partner, and you're thinking of, maybe the behavior is that, you want to make sure that women reports or whichever of the gender reports violence at home, for example. So you want to think about how do you measure that reporting back to maybe you've created a platform, so those are behaviors because maybe they don't report it, but now your program wants to make them report. So we say it's a measure of those concepts, those events, those behaviors, those things that happen within the scope of your program or your project. So those are what indicators are. So note that it is not those changes that you are trying to create, but the measurements of those changes, which in here we're talking about concepts, events, or behaviors. So some things to note. I mean, you need to develop your result statement at each level, which was what I was trying to do, right? At the input level, activities, output, outcome level, impact, if you think that your project would have an impact, so on the when you develop that, then you think about the indicators. So most times, so in reality, if you look at the second point here, you reach out to the partners, beneficiaries that you work with. For some of you, you're working with smallholder farmers. For some of you, you're working with a woman group. For some of you, you're working with young people. For some of you, you're working with maybe researchers. For some of you, you're working with a network of civil society organizations, maybe trying to strengthen their capacity. Whichever partner. So At Cloneshouse, we call everybody partners. So, and that's why you see beneficiaries in in bracket. So, we call everybody partner in delivering on any program or project. So, you as a program manager, which is common for civil society organizations or NGOs or civil society, broader civil society, you need to contact all these people to glean some of what they term as their sources, what they refer to as sources. So it might be that them still fetching water in the river is still something they like, because that is the only place they have a conversation, the opportunity to have a conversation, right? So you need to key that in rather than, oh, we'd like you to go to a bowl for you to fetch your water. So to have access to water or access to clean water. So you need to think about that. So I just brought that up as a narrative because, I mean, there's one argument around that. So, but it's important to have that stakeholder view of, yeah, what success means. Oh, okay, if they say that, oh, you know what, we need a guidance tool, or we need training, you need to build our capacity. That's what we're looking for. It could be a success at the activity and the output level. So when we do the training, what should be your change in behavior? What do you think we want? What do you want us to be seeing? You know, after you have been part of this training, what do you think you should be doing after that? Oh, okay, we should have been to be able to check our behavior to make sure that, okay, we are now behaving what we wanted. Okay, maybe we'll be visiting the primary healthcare twice in a month. That should be a success for what you're looking at. So stakeholders can give you all this overview, right, of what they think success is, or if it's for smallholder farmers and they're telling you that, you know what, grants is what we need, not loans, because we don't want to be under the pressure of when to pay back the loan. Or they say that, you know what, even if they're going to give us a loan, so we can measure ourselves with maybe 1% payback rather than you imposing on us 5% payback on the loan. So these are some of the conversations that can happen on you putting together your indicator. So, and it's important to make sure you understand what your beneficiaries would term as success and what all of you would agree as the success. So you are a facilitator in that point. And this is also where human-centered design. So it is also a component of human-centered design. But having said that, you can check yourself if you're listening to me and see how you came about your last proposal and putting the indicators on it. Most times, within 3 days, we just put up our proposals and we forget about the beneficiaries. I'm not saying everybody, right? So because we're talking about evidence-based information for putting together indicators. So some might have had those workshops in the past and just waiting for a partner to say, okay, submit a concept note and put together a mail plan in it. So it's important and is one of the key roles of any M&E officer within an organization to facilitate the development of indicators or development of the mail plan, which would have the indicators in it. So harmonize success statements and use it to develop your numerical and non-numerical indicators. So there are two types of indicator. So your indicator can be numerical, especially when it is in terms of quantity. So we talk about quantitative statements, or some people call it quantitative indicators. Then non-numerical measures qualitative conversations. In this presentation, of course, I can't go through everything. I'm just going to go through the categories. You can have counts. So when you say numbers, which is very, very popular, and is mostly used at the activity level and also at the output level, number of your participants, the number of participants. So at the output level, then number of trainings that was conducted, number of sensitization, number of rallies, number of toolkits provided, number of IC materials, number of health facilities reached, number of health facilities where outreach has been done, So it's in form of then talk about rates, of course, mortality rates, if 1,000 patients per year, deaths per year. So mortality rates, you can talk. So it could also be in form of rates, Also percentages, percentage of those in your program who are now saying that, they've been able to do XYZ, like they've been able to carry out this new behavior, or they are carrying out this new behavior at certain frequency. So that's the percentage. Percentage is mostly used at the outcome level for you to measure that real change that has happened. So also to note that outcome can be in two stages. So some do intermediate, some do immediate outcome. There's intermediate outcome also. So think about it that way. It could be in form of average or median. So the average score of your participants, maybe after your workshop, that could be something, or average age of the participants that participated in your workshop, proportion of men to women that participated or that attended your program. So these are the ways you look at your indicators. So they can be, and I'm talking about numerical indicator, they can be measured in counts, rates, percentage, and averages. Then you have the non-numerical indicators. So when you take out testimonies from your program, those are qualitative ways of measurement. When you say you do cases, cases of maybe several successful businesses or businesses who your program targeted, for example. So that's a way of looking at a non-numerical indicator. Existence of laws, existence of a new thing in a program which wasn't there before, creation of new things which were not there before. These are all indicators that you try and look out for. And most times your non-numerical indicators, you find them at the outcome level, output level in some cases. I think one thing I normally encourage is that we are quick to use numbers. We use numbers a lot, actually. So, but try and be using proportions, at least average. Also, if it's a gender specific program, you want to look at maybe average age of women versus men that were part of the program. So you've taken average and proportion together, So you can do this. You can use other measurements other than numbers. And I'm saying this because we normally see numbers all the time. Then think about the qualitative measurements also as well on your indicators. And I think that that would make a whole lot of sense for your MEL plan or your monitoring and evaluation plan. So research other projects for pre-existing and relevant indicators. Yes, there's a whole bunch of indicators already, especially for each type of thematic area you're working in. I did not start with it because of context, because contexts are different. Places where you carry out your programs and your projects are different. So you want to think about, first of all, getting knowledge, getting what sources from your participants or beneficiaries or partners. Then there's a portal. So I'll stop share and just quickly share that with us. Indicate.net. If you're looking for, so I would say inspiration on indicators, even though I already have some examples in the slides that I shared with us. So feel free to check out indicate.net. Just post it in the chat box if possible. So yeah, you can check out. So if you're working in any area, environment, sector indicators, sector specific indicators, you know, so is it sectoral or those cross-cutting things like gender, social behavior change, communication, advocacy, social media. So things that are cross-cutting, you will get sectoral indicators, food security, WASH. If I'm working on WASH, for example, I can click here and you would find different indicators. You can see those on diarrhea, water-related indicator, hygiene indicators, sanitation indicators. So you can make use of any one of these, you know. So you see some indicators already, number of people having access to basic hygiene, you know, hygiene items. So, of course, this is generic. So you need to think about if you have provided some basic hygiene items, then you streamline it to those items. So you can see examples of how you can also analyze the data here, and they define the indicators for you. So you can make use of a whole bunch of these if you're working in the environment, climate change, resilience. So you have that. If you're working on nutrition, there are already indicators for that. You can check out all the indicators that are here. So indicate.net is a place for you to go. It's a one-stop shop, and I encourage you to make use of it, use it in developing your indicators.